Okay, I get the pleasure of introducing Ron here. Interesting points here. The title of his presentation is going to be Autonomic is not automatic. Here's some good points. While in medical school, Ron and 5 English medical students snuck onto the set of the movie Dave. They managed to get behind the scene, actually in the scene with Kevin Kline when he sings a song from Annie to the police officer outside of the Adams Morgan, and actually managed to get paid for it. This is a really good one. His Egyptian father proposed to his East German mother while she was visiting him in Egypt the day prior to the Berlin Wall being built. She decided to marry him rather than return to East Germany. That's an awesome point right there. And Ron also had an arrhythmia at the age of 37 that began to wake him up, and he also was physically burning out and realized that his rehabilitation and pain management, being a rehabilitation and pain management physician, that he had to develop a more mindful pain management approach that would benefit not only himself but his patients. So, introducing Ron.
Thank you. Can you hear me? So it's great to be here. I was hoping to be provocative today. These are my musings and my story, and take what you like. But we have this top-down mentality that our brains tell our autonomic system to regulate blood pressure, bladder, so forth. And I want to sort of throw a stick in the spokes of that and start to get you to think a little different ways. So at age 37, I had atrial fibrillation, about 30 or 40 years, probably sooner than would be typically scheduled. I spent a night in the hospital, although after spending a lot of nights in the hospital, this was the first time I got to be a patient. The cardiologist discharged me the next morning. Unlike your physician, he told me, you have no risk factors. And so, unlike the statistic that's thrown out a lot, that most healthcare is some sort of behavior in nature, he told me there was really no behavior that I was doing wrong. And I looked at him, and I'm thinking, could it be stress? And he said, no. I said, can you look at me? I'm a mess. So I had to start figuring out what I was going to do. And I'm an electrophysiologist, I'm a rehabilitationist, but I also do pain management. And I thought I had a choice to start looking for a way out of medicine, or maybe try and find a way in what is oftentimes a hopeless field in chronic pain. And it just confirmed again, just April, that central sensitization, chronic pain, is not curable. And I'd like to throw a stick into that spoke as well. And I'd like to introduce a concept, autonomic nervous system regulation. How can you, instead of getting bogged down in psychology and DSM-3, how can we learn to regulate our autonomic nervous system and become healthier and manage behavior that way? This is, and that's not necessarily a way out, but a way through. And this is a picture that one of my patients, who was at one time completely dependent on, for hope, injections or narcotic pain medications. And she painted this on the inside of her door. It's a picture of a local bridge. Most of her friends live on the other side. This is her hope to start re-engaging the world and increase her activities and hope. And even she had another setback 3 months ago with a small compression fracture, and she was able to dance last week at a reggae festival. So she keeps moving forward in a much more hopeful manner. I want to throw a stick in the spokes of a very good book called The Power of Habit. But the golden rule, they say, is we know that habit cannot be eradicated. It must be instead replaced. So choose your hamster wheel. Not you get to get off the hamster wheel. You have to choose a hamster wheel. So choose the least destructive, or choose the most healthy one. You know, be a workaholic, you know, be a treadmillaholic, you know, choose something like that. But there's a powerlessness to that. And this cycle creates a craving. And what I think is happening with some of my pain patients, they crave to be pain-free. And if we think of the autonomic nervous system, fight, flight, or freeze, you can start thinking of anger as just a behavior that's secondary to fear. If you accept that fear is the fundamental human emotion for the autonomic nervous system, you can start to explain behavior. In the middle, avoidance behaviors, there's several ones. It could be alcohol, it could be quitting, it could be online shoe shopping. The beauty of the internet now is unlimited avoidance behaviors out there. And then the end product can be postural hypertension, it can be depression. I'd like to throw a spoke in the wheel of constantly thinking about depression in biochemical terms, but thinking about it as an exhaustion of the autonomic nervous system and the electrophysiology behind that. So if you like any of these terms, tweet them. I like this one when I'm talking to, I work with a couple of college coaches, basketball coach, a wrestling coach, and when I'm trying to, and they're pushing them and pushing them and pushing and burning out their players, try to get them to value sleep and the hormonal consequences of that. And it's no different when you're talking to a patient with fibromyalgia. And so this is a very interesting notion that fear ruminations amplify pain for elective procedures. So you're going to have an elective hip procedure, you're craving to be pain-free, but these fear ruminations ahead of time predict that you're going to have chronic pain after you have the hip replacement. Through my own process of getting burnout and trying to figure this out, came across something called heart rate variability. There's assessment tools, there's biofeedback, and I think it's the measurable version of what mindfulness is. So the brain is actually listening to the heart, believe it or not, like all the songs and verses will tell you. And something happens, and at this point in this day and age, what's going on from left to right is just data points, and we can create all kinds of tools, and the vagus nerve carries this parasympathetic information to the brain, and the brain realizes that the heart, that you're kind of calm down here. Maybe it's an opportunity to break free of the fight or flight response, move into your frontal lobe, and make a value choice to, am I going to react with fight, flight, or fear, or am I going to choose something else and get off the hamster wheel? So I like to think of meditation as listening to breath, thought, and emotion, yoga as listening to body position, and Tai Chi as listening to body movement. And in a day and age of a lot of doing, maybe the skills of listening can equalize and make us more balanced. So then we're scientists, so we ponder all these kinds of words, and they have very similar emotions, but they have different connotations. As scientists, everything we do is try and avoid bias. But one of the big buzzwords is engagement, very similar to that. As a physician, you probably shouldn't be treating your fiance because you lose your good quality judgment. And in pain management, a lot of times hope is linked on what is the next unproven treatment plan. So I propose that an ethical placebo effect can be believing in yourself. And how do you get someone to believe in themselves? I try and get them to believe, what keeps you up at night? Is it the pain, or is it your racing brain, the hamster wheel? A lot of them just say, I need a vacation from my brain. And so if you can start using these tools, you can maybe potentially, the criticism I can get sometimes is, well, this is just a placebo effect. And I say, so what? If I'm telling you, believe Dr. Gharbo's elixir, that may not be ethical, or these tools. But if I get you to believe in yourself, that's an ethical placebo effect with, I'm not aware of any risks, and can be potentially powerful. So then the next thing I come up with, after a long thought, is a black swan is something that seems obvious afterwards, but not beforehand. So it seems obvious to me now that if the fundamental human emotion of fear, of the sympathetic nervous system, is fear, then there's got to be a fundamental human emotion for the parasympathetic. And it's instilling trust, and trust is the foundation to all relationships. So that's what I propose. And that's what the types of things that inspire me to come to work each day. A more practical example is we're doing a project in the hospital, and one of the problems in pain management is we have experts on physical pain, and then we send you to somebody else who's an expert on the emotional component. And neither has enough expertise in either one of them. And we like to try and address both, and I think both of these are true. If somebody's going to carve out your hip or your knee, there's no debate. There's going to be some physical pain. It's inevitable. we try and address that. But at the same time, if there are some tools and we engage and we foster the placebo effect in an ethical manner to empower you rather than line our pockets, then maybe it can be a very powerful tool. So I appreciate some of the speakers today. This is my side wantrepreneur project on the side. I don't know where it's going, but I sure have a lot of fun thinking about these things. Thank you.